Hello there, I'm Dr. Samantha Durland. I'm board certified in obstetrics and gynecology, in anti-aging and regenerative medicine, and fellowship trained in metabolic and nutritional medicine. And what we're going to touch upon now is we are going to talk about how to enhance our female sexual experience and orgasm. And I'm just going to kind of talk for a little while, and I may jump around, but hopefully there's going to be a pearl of wisdom in some of this, because sometimes when I get to the vagina and I think about it, there's all these thoughts come to mind, and it's so overwhelming of how to organize it because there's so much fun things to talk about. So one of the things I would like to start about is the GSpot. What the heck is this? Gosh, love it. I think it's an abyss of, I don't freaking know. And so in medical school, does anyone teach you about a GSpot? No. Does anyone teach you about a bundle of nerves sitting behind your pubic bone? No. You hear some people say they feel it, some people say they don't. So as a clinician and a physician, I feel like this is a little obscure. So I also want to say, as a physician that has taken care of thousands of women, interviewed thousands of women naked for their annual examination, and talked to them one-on-one, there is a much different conversation that we have one-on-one when we're really our true selves than when we are at school pickup line or out in public. So I really feel like the perspective that I have is hopefully much more genuine to what really goes on, because in crowds, we just don't speak as genuinely usually, and certainly in the pickup line at the grade school pickup line, that's not the place that we really kind of talk about these things genuinely. So that being said, if I could tell you the stories that I've seen, what would I say about to help an orgasm or help our sexual health? Well, number one, I've heard various things. So one thing I've heard with oral sex is that some people, I think I've talked about this before, some people actually put candy in their vagina. Yeah, like Pop Rocks or whatever those are, or Jolly Ranchers. And so people sometimes will go, ooh, and then they're like, well, they get an infection. And I tell them, the vagina is a self-cleansing unit. So no, you really don't. So I'm throwing that thought or that concept that I've heard out there. The other thing I'd love to say about oral sex is a lot of people don't think about the fact with oral sex that if their partner has a history of herpes and they have a cold sore, they could totally give you herpes that way. And 10% of the time you can shed herpes on your skin and not know it. So I'll have married couples come in where the woman is in her 40s and all of a sudden she has a primary herpetic outbreak and she's horrified. And I go, no, look, it took you like 20 years to actually get a primary herpetic outbreak. You know how unlikely and statistically difficult it is for you to do that? So anyway, if you're having oral sex and your partner has cold sores, just make sure they take some acyclovir or Valtrex, and then that helps prevent their asymptomatic shedding, that they don't even know they have it. So then you don't hopefully get primary herpetic outbreak. And if you do get a primary herpetic outbreak, you know what? Herpes is in the same class of viruses like chickenpox. Chickenpox is a herpes virus, so it's not going to kill you. Don't feel bad. Don't feel like there's something super wrong with you, that you're not going to be okay, because I talk to people all the time about herpes as well, and they feel there's a lot of emotion attached to that, sometimes like shame and fear. And I tell them there wouldn't be like all these commercials, because millions of people take their Valtrex and acyclovir if it wasn't really common, and it's not going to kill you, and it doesn't give you vulvar cancer or ovarian cancer or vaginal cancer or uterine cancer. You take a medicine, you'll be okay. So don't feel negative, shameful, or condemned about that. I just want to get that out there too. So that's the first two things I wanted to talk about. And then let's talk about vaginal lubrication. Okay, so when we're postmenopausal, certainly we start losing vaginal lubrication because hormonally those hormones leave us. And that's normal. There's nothing bad about that. So you can do procedures, or you could take systemic therapy, or you could take localized therapy. They're all options. Now, sometimes we can also have dryness before that point in time. And why the heck would that happen to a woman? Well, dear goodness gracious sakes of fire. I'm not a guy, so I'm not quite sure what intercourse feels like from a male's perspective, because I do not have a penis, I just have a vagina. But I would say, as a woman in this body with a vagina, if I start, it's like a known and fear or pain would make me dry, okay? And it would make me dry because in my brain is like, how do I get into this if I'm a little fearful of it? Or how do I get in this when there's pain? I mean, how are you supposed to relax and be in a moment if you have been hurt there before? Or if you're fearful? Because what you're going to notice with fear And pain is every human being will clench up, and there is no lubrication going to be involved with fear, because it also is stimulated by this neurological place. And so for women, I feel like a lot of my sexuality has to do within my mind. It's this huge, crazy math problem about how I feel about myself, how I feel about my day, my stress level, my hormone levels, my prior sexual experiences. It is so abstract and challenging. And so there's a lot that goes on into our mind. And so vaginal dryness a lot of times before menopause can go along with that paradigm. So you really kind of have to sit down and go over things like if you have endometriosis and your pelvis is all stuck together because there's a lot of scarring up there, well then every time you have sex that hurts really, really bad. So no matter how positive a thinker you are, no matter how much lube you use, it still hurts. So we literally in that situation have to take care of the problem. Now, there can be transient processes in the intra-abdominal space, like I had a big ovarian cyst or something, and maybe when I had sex, it totally freaking hurt really bad. And my brain's like, oh, this doesn't feel so good. So then the next time I go to have sex, I'm fearing that happens. And so my body, loving me, is going to protect me and clench up my pelvic floor. As it clenches up my pelvic floor, if you hit that pelvic floor, whoo, it hurts a little bit more. So sometimes I get pelvic floor tightening as a protective mechanism from a prior experience, and that has to be unlearned, and that is where sometimes some physical therapy may come in mind, or some medication may help too, and we just kind of help dissociate that until your brain can learn, oh my gosh, this is not painful, and then it can kind of let go. Another thing that we can do is there are other topical products that you can do on the outside too, and this is kind of moving down from pain. So pain is either a learned response from an actually painful experience, or there's actually an anatomical process inside that needs to be fixed so that it doesn't hurt anymore. And then there's vaginal dryness. Vaginal dryness that happens post-menopause can be treated with procedures as well as medication or hormonal medication to the vagina. Centrally wise, if there's been a learned response, then we have to unlearn that. Now, how can I increase the pleasure of my external genitalia, if you will, to make it better? All right, so this gets really fun because really when you think about our psyche as a female, that is hard, right? That is so complex, but it's not unreasonable to work with. So you just have to take time and sit down with someone who will listen. Our body is actually so easy, it's a math problem. It's just a robot, our body is. And so anatomy and regeneration of biological tissues and stuff usually is the easier concept to deal with. So how am I gonna help my brain be more relaxed in the act if it's more fear? Okay, so one of the things I can do is there's always the shockwave therapy that I really think works really well for men for erectile function. We can totally use that for females as well. And so shocks sound horrible, like I'm going to give you some electrical current to your labia, which does not sound pleasurable at all, but actually it's sound waves. And so what we do is and it helps regenerate vascular flow and neurological sensation. So we actually use this to the clitoris, the labia, and the pudendal nerves. So what the heck are the pudendal nerves? They're these two nerves that come out on both sides down in my kind of groin, and they feed the sensation of the outer labia. And so if I ride a lot of bicycles, those can be injured. Sometimes during child labor and being pregnant, they can be injured, so my actual sensation is reduced. So the cool thing about nerves and blood vessels is they love to be regenerated, and sound waves can help do that. So we've had a lot of great luck with doing that, with using shockwave therapy for females, and then also I'll put it in the vagina and arc it up towards the G-spot to hopefully help regenerate that nerve bundle to give women better orgasms. And I've never met a woman that doesn't love to have an orgasm. And I've also met a lot of women actually in their perimenopausal period that have never had an orgasm before. And I was just like, oh my gosh, gracious sakes of fire, we got this. We are on this. Because as a fellow female, I would love to be part of your journey to help you feel your body in this realm, because we should all feel that. The other thing too is our clitoris. Okay, let's talk about that for a second. So the clitoris is this little piece of skin, if you will, that's right underneath the top. Your urethra is at the top, and then you have this little skin over the top and the clitoral hood. So if you pull it out, your clitoris is there. So for some of us, anatomically, maybe our clitoris is a little smaller, or our clitoral hood is a little bit more robust, so you don't feel as much. Well, your clitoris has got to be stimulated for you oftentimes to have an orgasm. And so if your hood is over your clitoris, you can't feel as much. Well, gosh, love it. We just got to get that clitoris a little bit more robust. We got this. And so that can be done with some stuff called Scream Cream. Now let's talk about Scream Cream. Okay, so Scream Cream is a collection of various topical products that cause vasodilatation. And vasodilatation is just opening of the blood vessels. So your clitoris gets a little bit more puffy, if you will. Not puffy that you're going to walk around and it rubs on your underwear and it makes you psychotically feeling crazy. But what it does is it just makes it more sensitive. And so if it's more sensitive, if your clitoris is stimulated, usually your brain, I think as a female's brain, your brain's like, do, and all of a sudden it's like, oh my gosh, I have a clitoris today, and it's like, it keeps happening, it keeps being stimulated, and pretty soon your brain, even if it is fearful, even if it doesn't want to go down there, pretty soon it can't not think, and it's like, vroom, it starts thinking through your clitoris for only a few moments, of course. And if that can start happening, you know what, you'll start to get more moist. That is for sure. If you can bring your brain to your clitoris, and your clitoris is very pleasurably stimulated, then lubrication totally starts happening. And then once your brain gets in that space, then it becomes an easier space to enjoy the act of intercourse. So when a lot of people will give Scream Cream just before you have sex, but my point as a fellow female is that is the craziest thing I've ever heard. Like, what my problem as a female is I just don't want to have sex sometimes, and my partner, though, it's a place that I connect with my partner, so it's important that I do that. So I just advocate for women, put it on every morning when you wake up. Maybe you'll think about your clitoris a little bit that day, and also put it on maybe before you go to bed, because maybe if you have sex, you'll have better orgasms, and no one ever complains about that. So that's another thing you can do. The other thing I talk to a lot of women about is vibrators, and I'll talk to them about that because, you know, as a female, I believe that if I stimulate my clitoris, I'm so much better at it than anybody else, simply because I know how much I would love it to be stimulated and how much I don't want it to be stimulated, and so you just have more control over that. And so anyway, sometimes if you use a vibrator while you're having sex, it again brings your brain to your clitoris, which makes you more aware of that area. That can make it more pleasurable, and then over time you can kind of learn another space that you allow yourself to be into, and that your control over that really helps you too. Another thing that sometimes people will have is maybe people have learned a lot of discomfort down there, and they have dyspareunia, or they have vasospasms or vaginismus, and that is where when anything gets introduced into the vagina, there's this really strong contraction to not let anything in, and it's painful. And so I've had many patients that I've talked about that, and so we'll talk about various things you can put in the vagina, because you as a woman, if you put it in, you are not going to hurt yourself, and so you can kind of hopefully potentially desensitize yourself over time within your own space. And so things that you could put in your vagina include, like, tapered candles are really good because they start out really small and then they widen towards the bottom, and so you can kind of gently, kind of put that in, and then if it spasms, just wait for a moment, sit and calm. You're not going to hurt yourself, and then you could advance it a little bit further. So by having an opportunity to be in your own space with your own self, sometimes you can kind of help desensitize your body's vaginismus as well, because it's really hard to do that with another human being, especially in a sexual act, because to tell your partner, I'd like you to go slow, please don't hurt me, they get so excited that sometimes it just introduces this emotional barrier sometimes. And so I just want to throw it out there as a fellow female, that open up that space for yourself. Be okay with your vagina. Be okay with helping it. It's part of you. And if you need help in this space and someone to talk about it, that's what we love to help people with too. So just know that we're here for you, or find someone that you are comfortable with to help you kind of navigate this space. So if being moist during intercourse is a challenge, hopefully this has been super helpful for you to talk about. So again, if you're postmenopausal, hormones, Also, procedures before you've gone through menopause, know that there can be anatomy that's up inside, or if it's learned, pull your brain to that pleasurable space with stimulating your clitoris using various topicals, vibrators, shockwave therapy. There's just a lot you can do. So don't be afraid to talk about it. Hopefully this gives you some ideas, and if you need somebody more to talk with, we're here. So I hope you have a great day. I hope this has been super helpful. Orgasms are awesome.